Hello, Dr. Steinway here from Steinway Family Dental Center. We get a lot of questions about bite adjustments, so today I'm going to answer some of the most common questions we got on this subject. The first question is, what is a bite adjustment? Well, if somebody has a bite that is traumatic to them, it needs to be adjusted or changed. And how do you change that? It depends on what the problem is. Why is there traumatic occlusion or traumatic bite? And the doctor will look at it and make a decision how to better help you with your incorrect bite. What is the most common reason for the patient to need an adjustment, especially after recent procedures, after the filling or crown and so on? And the answer to that is that if the patient cannot get used to the bite because the bite is in supraocclusion or it's too big, then you would need an adjustment on it to make sure that all the teeth fit equally. Sometimes the patient is numb for the procedure and therefore doesn't feel it right away. And then when they go home, when they're no longer numb, that's when they start feeling. That's when they feel that, oh, maybe I should have been spoken out and about this, that I do feel uncomfortable with it. And it's very simple, you just come back and get it adjusted. Usually there is no charge for that and it's fast and painless. What symptoms can patient experience if the bite is not properly aligned? Well, number one, if it's after recent restoration or recent work, then you can feel that the bite is off, because when you close your mouth, you feel biting on that particular tooth that had the work done recently more than you biting on other teeth. That's of course, we call it in supraocclusion or too much occlusion, and then the doctor can adjust that to make it equal with the other teeth. There's also parts when somebody can grind their teeth and they will destroy some of the tooth structure, or they're clenching their teeth at night when they're not aware of it, and they're destroying the bite, and because of that they can get pain with the joint here. So it's called temporomandibular joint. And basically it's the joint here. The joint is basically like elbow. When the elbow joint is in equilibrium, when they sit like that, I'm very comfortable because my muscles are in equilibrium and it's not bent like that and it's not straight like that. Otherwise I can't hold it straight like that or bent like that forever, right? It's not comfortable. If I put it like this, I can sit pretty long time because my muscles are comfortable here and my joint is comfortable. So if you're clenching your teeth at night, basically the same as if you're doing this to your elbow, of course you're going to feel uncomfortable here. The symptoms for that would be, you can either feel when you wake up in the morning, it feels like you've been talking all night and your muscles are tired, or you've been chewing all night and your muscles are tired. Also, when you eat, you get pretty fast tired of chewing your food, right? If you have some kind of meat that is hard, or you bite on a bagel and you chew it, and it kind of requires a lot of effort and you feel getting tired by just chewing it, something is wrong with your bite. So you would seek an opinion of a dentist and see how could that be helped. How is the bite adjustment performed by a dentist? Well, the dentist first checks the bite and see where is the extra contact that not supposed to be there is, and then they would adjust it and make those contacts smaller or lighter, so it doesn't hit right in. There are certain parts of the teeth that's supposed to be in contact, and dentists know what those parts are, and they would adjust it in a way that you would get correct touching of the teeth. Can orthodontic treatment like braces or Invisalign fix open bite, overbite, or tight bite? And the answer is yes, it's possible, especially in Invisalign, because with Invisalign you can correct bite as well. What is the difference in correcting open bite or cross bite? Cross bite is when the teeth that's supposed to meet, let's say the upper jaw is always bigger than the lower jaw, right? Then that means that the upper teeth should be on top or bigger outside, then the lower teeth should be inside. If it is in what we call cross bite, because let's say the lower teeth are bigger than the upper in one part or the whole mouth, then it's either partial cross bite or unilateral cross bite or cross bite, period, right? So what is the difference on treating them? It depends on what treatment the doctor will select for you, or what what is the way of treatment, whether he's going to use braces, he's going to use Invisalign, or maybe he's going to use a jaw surgery. It's orthodontic surgery, it's called. So that is up to the doctor, but it's based on the problem that you have. So the doctor will have to examine you, and then he would plan the treatment accordingly. Can bite issue be ever corrected naturally without any dentist or dental intervention? The answer is no. The only thing that fixes that is the dentist. What is the typical cost for dental adjustments like that? Well, like I said, if it is just right after the restoration that the doctor did, it would be free. So that's one of the treatments. But if it goes all the way to the point when you have to have Invisalign, let's say, to correct your bite, of course it comes with a price tag. But you should ask your dentist, or if you don't have a dentist, you can come here and I can answer that for you by checking you out first, of course. The telephone number here is 718-728-3314, or you can go online on alldentalneeds.com and request an appointment. And when we will meet, I'll answer all your questions, so we would know what you need and what could be done about your bite.